what are going to be the side effects or likely side effects of chemotherapy uh, if they decided they wanted to go through chemotherapy? Are there some ways that they could mitigate the side effects with it on an integrative and natural basis? Um, and then also, I'm also asked what the length of, how long could some of these chemo side effects last? So, and how could they go about mitigating some of those side effects, or even enhancing the chemotherapy to get, more use out of it, if that could even possibly be done on an integrated basis?
Okay. Yeah, so there's a lot of meat in that question.
Mm,
So let me do my best to try to answer. So first of all, in regards to chemotherapy, not all of them are the same. So there are some that are more harsher than others, and some, believe it or not, that are, not as hard. Uh, Usually the side effect with some patients tend to bring up a lot is if they have hair, it's like their hair falling out, and with certain chemotherapy programs. So there are some that do that, but there are actually some that don't, or they may be thin now. So it all depends, and and sometimes there's like maybe one or two drugs, and sometimes there's a cocktail. And then remember too, like that term chemotherapy is there's I think there's an older definition of that word, and there's a newer definition. And so the older definition is like the older drugs that were more harder, that the older the chemo drugs, like, say, like oxaliplatinum or cisplatin, or the 5-FU or the taxanes or adriamycin, those things. But now they're starting to lump even other drugs that would be considered not so much chemotherapy, but they're a different type of drug.